Dear colleagues, I have great honor to present one joint work of otologists and rhinologists from the two university hospitals in Serbia, and it is about Samter triad and otologic manifestation of this disease. There are few synonyms about same condition. We have Asa triad, we have Samter's triad, Widdel's triad, and aspirin-exacerbated respiratory disease is a well-described condition manifesting as eosinophilic nasal polyps, aspirin intolerance, and non-atopic asthma. There are only few published reports describing otological manifestation of aspirin-exacerbated respiratory disease, and all are case reports or analysis of case series. All of them are dated from 2009. From the rhinologist point of view, otitis media with diffusion is in patients with nasal polyps are extremely rare condition, as well as otitis media with diffusion in patients with Samter triad. But patients with Samter triad more likely develop otitis media with diffusion than other nasal polyps and asthma patients, and risk being about 26%. Also, the risk from the otitis media with diffusion in a Samter triad patient was estimated to be 5 times higher than risk in patients with only nasal polyps. Otitis media with diffusion often develops subsequent to the other manifestation of otitis with aspirin-exacerbated respiratory disease, and the development of otitis media with diffusion could be considered one more step in the severity of the underlying inflammatory respiratory disease that leads to the nasal polyps, asthma, and aspirin intolerance. Otitis media with diffusion in Samter triad should be included in the concept of United Airways inflammatory disease. From the otologist point of view, the middle ear pathology in patients with Samter triad is an outcome of the underlying mucosal inflammation itself, rather than obstruction of eustachian tube orifice. Also, otitis media with diffusion associated with Samter triad is very difficult entity to treat and doesn't recover with standard treatments. Patients with Samter triad and otitis media with diffusion have conductive hearing loss, but frequently develops sudden, profound sound sensory neural hearing loss. The prospective cohort multicentric study was performed in 2 tertiary university centers, Clinical Center of Serbia and Military Medical Academy, from November 2016 and January 2019. The study subject consists of 15 adult patients with otitis media with diffusion and 15 healthy participants. In otitis media with diffusion group, we had 5 patients with allergic rhinitis, 4 were with nasopharyngeal lymphoid hyperplasia, 3 were without evidence in a nasopharyngeal disease, and 2 had confirmed Samter triad. This is the first and preliminary report to show the simultaneous assay in 13 cytokines and hemoquins of middle ear and nasal concentrations, secretion in patients with Samter triad and otitis media with diffusion, and their comparison with adult patients with otitis media with diffusion with different etiology. The aim of the study is analyzing differences between patients with otitis media with diffusion associated with Samter triad and controls, and investigation of their middle ear and nasal secretion of cytokines and hemoglobin concentration. And we try to answer the question, is otitis media with diffusion associated with Samter triad, a new nosological entity? Here we present a main preliminary results. There were significant positive correlations between concentration of 7 cytokines and hemoquins in the nasal and middle ear secretions. It was presentation of uniformity of inflammatory mediator production in nasal and middle ear mucosa. And it is support the concept of united airway respiratory disease. When we compared concentration of 13 different inflammatory mediators, only interleukin-18 middle ear and nasal concentrations were significantly different between the Samter triad group and non-Samter triad groups. In Samter triad group, the levels of interleukin-18 were significantly lower than in non-Samter triad group. This is the result of possibility that these cytokines does not specifically involve in otitis media with diffusion pathogenesis in patients with Samter triad. A number of studies have shown that the presence of immunoregulatory cytokines in adults' middle ear secretion and with different etiology. But the precise relevance of these findings will become clearer when the roles of the different cytokines in diseases have been better defined. In our study, the duration of the ear symptoms in patients with otitis media with diffusion was correlated with monocyte hemoatropine protein 1 level. MIS-CP1 is a potent eosinophilic chemokine and activates the transendothelial migration. When we compare characteristics of patients from the literature and from our study, we found that otitis media with diffusion in the literature described that it develops in advanced stage of aspirin-exacerbated respiratory disease. Our patients were in their 60s. They had bilateral middle ear disease, like in the literature. They had thick, highly viscous mucosal type of effusion in middle ear. They had both conductive or profound sensory neural hearing loss, like described in literature, and we have problems with treating this patient. In literature, otitis media with diffusion associated with Samter triad is very difficult to treat. We had a lot of recurrence, and mastoid surgery didn't show permanent cure in this patient. What are key points? Some author further proposed that adding otitis media with diffusion to aspirin-exacerbated respiratory disease results in more severe form Samter's quad or Samter's tetrad syndrome. They found that mastoidectomy gave only temporary relief and suggested aspirin desensitization therapy or watch and wait policy or conservative treatment with topical steroids or antibiotics. Sensory neural hearing loss is frequent, and it is important to take this precaution when treating this patient and constantly monitor their hearing by audiometry. And I want to conclude that otologists and rhinologists should work together to better define this tetrad syndrome, but also in order to improve the quality of life of these patients whose otitis media with diffusion has most of the time revealed very difficult to treat in our clinical experience. The development of otitis media with diffusion could be considered as one more step of severity of underlying inflammatory respiratory disease, leading to nasal polyps, asthma, and aspirin intolerance. Thank you for your attention.
Do you have any questions? Professor Kalođera?
You said that there was a significant correlation between cytokines and chemokines which were more Th1 profile from the nose and from the ear, which you collected from the ear. I'm interested if, do they only correlate, let's say, MCP1 from the nose with the MCP1 from the ear, or they correlate also significantly among themselves, which means MCP1 and IL-1 alpha with also together. You understand what I'm asking? Yeah.
This conclusion was only from middle ear secretion and MCP1 and duration of the symptoms of ear symptoms, conductive hearing loss or ear ball gaps, only for that. Duration of symptoms and MCP level in middle ear secretion.